Hi, I'm Ingrid Ulrey, Regional Director for the Federal Department of Health and Human Services, HHS Region 10, which includes Oregon, Washington, Idaho, Alaska, and 272 federally recognized tribes. I was appointed to the Biden administration to this position in November of 2021, after previously serving in leadership positions with Public Health, Seattle-King County, AARP, SEIU, which is a labor union representing frontline healthcare workers, and PATH, a global health organization. As a gay woman, a mother of two, a caregiver for aging parents, and as someone who has dedicated many years of my life strengthening healthcare infrastructure in corners of the world with very few resources, I come to this work with empathy for people who are struggling to access care and a deep commitment to health equity, which is why I'm honored to work for HHS Secretary Javier Becerra, who has pledged to put health equity at the core of everything we do here at HHS. This commitment is especially important in light of the many inequalities that have been exacerbated by the COVID pandemic, and as we struggle to heal racial divisions and move toward recovery. As Regional Director, I work closely with the alphabet soup of large operating divisions that make up HHS, such as CMS, which administers Medicare and Medicaid, SAMHSA, which addresses mental health and substance use, HRSA, which supports countless programs to reduce health disparities for marginalized populations, and many others, including the CDC and other major drivers behind the nation's COVID response. My role is to be the front door to HHS for people across all of Region 10, from our coastal cities and their surrounding suburbs to the rural and frontier areas to the east and to the north, and inclusive of many small tribal villages accessible only by plane up in Alaska. I love this region, both for its natural beauty and when it comes to healthcare, for its creativity and innovation. My team works to understand how HHS policies and programs are impacting people on the ground and to ensure that our efforts are informed by your experiences. On a day-to-day basis, we're engaged in meaningful dialogue with our region's governors, mayors, and tribal leaders, as well as hospitals, clinics, and frontline healthcare workers. Our goal is not only to share information about HHS initiatives and funding, but also to troubleshoot with you to address gaps and challenges and to amplify your successes. At this point in time, the Biden-Harris administration and Secretary Becerra are focused on many critical objectives and priorities, which, to name a few, include tackling COVID-19, promoting mental health and wellness for all, and lowering healthcare costs and expanding access to achieve equity. Related to COVID, we've come together as a country to respond to the pandemic and now have more tools than ever to fight, prevent, and treat COVID-19, including vaccines, boosters, and therapeutics. My office is working with partners and communities across Region 10 to remind people that vaccines are safe and effective and that boosters are important to sustain immunity, especially for people who are immunocompromised and for older adults. And we are working with health officials across all levels of government to track the virus as it continues to evolve, protect the capacity of our healthcare system, and encourage people to take sensible precautions so that everyone can stay safe. At the same time, we're working to address the toll that this pandemic has taken on the mental health and well-being of people of all ages, and the commensurate rise in rates of anxiety, depression, suicide, and overdose deaths. In his State of the Union address, the President called out mental health as the defining issue of our day. He announced a national mental health strategy that will build on actions taken by the administration in the past year, including more than $3 billion in American Rescue Plan funding for mental health and substance use block grant programs. In Region 10, my office is working with state and tribal leaders to leverage this moment to invest in behavioral health systems across the continuum of care, achieve parity, and integrate services so that everyone can easily access the care they need and stay whole. Since the passage of the Affordable Care Act, our nation has made great strides in reducing the number of uninsured and lowering costs. And during the 2022 open enrollment period, partners across Region 10 enrolled nearly 500,000 people in quality health care coverage. And now our state officials are working hard to ensure that this coverage will remain steady with the end of the public health emergency. Expanding coverage and improving quality of care is critical to address unacceptably high maternal mortality rates, particularly among Black and Native women. HHS is and will continue to work with partners to support safe pregnancies and childbirth, following the Vice President's call to action on this issue. And we will work with partners to continue to improve access to quality home care and quality nursing home care, which are essential for people with disabilities and for our elders. All of this and more, including sustaining the gains of telehealth discovered through the pandemic and addressing chronic workforce shortages, is critical to achieving health equity. To close, I want to emphasize that this administration, with your help, has made significant progress in health and human services for our nation, and there's more work ahead. I'm honored to serve in this role, to build relationship with so many incredible leaders across the Northwest, and to support the government-to-government relationship with our 272 federally recognized tribes. So thank you for listening, and hope to meet you soon.
Produced by the U.S. Department of Health and Human Services.